What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues, and that goes for any of the viruses that are ongoing right now because there are a lot of them. Welcome to the Wednesday edition of the Pandemic Update for Wednesday, December 13th, 2023. First off, if you're new to my channel, welcome to my channel. I've been gaining a lot of subscribers lately. I've noticed the viewing on my updates have been going up. That's fantastic. If you haven't subscribed yet, subscribe to my channel down below, and I promise to help keep you safe. If you learn anything at the end of this video, subscribe and thumbs up. Alright, starting off today, we do have several news stories. Then we're going to do something about, things moving along a little a little faster than reality says they are. And I think you know where I'm going with that. People trying to just move on from the pandemic, but hey, it hasn't ended. And then, of course, we do have some of our weekly and daily data to take a look at. First off, I have to share this. New COVID variant JN.1 could disrupt holiday plans. This is 100% true. The problem with this is that the holidays are coming up. We're in the middle of a new variant. We're now at approximately about 1 million cases per day. This is going to go up even higher. We still have the rest of this week, the rest of next week, then that Christmas week where people are going to travel for Christmas, for New Year's, and every other holiday in between. And that's going to be the real climax of the cases. Then the start of 2024, cases will hopefully drop a little bit. But until then, cases are going to continue to go up to somewhere between 1.5 million to 1.6 or 1.7 million cases per day. Hopefully not higher than that. I mean, as is, 1 million cases a day right now is just totally ridiculous. This is as estimated from wastewater. We do know a lot of them are asymptomatic. The problem with asymptomatic is you could spread it to someone who's immunocompromised, or you could spread it to someone in general, and then they become symptomatic. Then they get moderate COVID or even severe COVID. I mean, this is how it works. So right now is a super risky time, and you're going to hear me say this a lot. I'm going to say it now. If you have a holiday gathering, I know Hanukkah still going on. Maybe it's ending soon. Christmas is coming soon. Weekend gatherings are coming soon. Please, please, take a test before you do anything. Just take an at-home test. If you don't have any symptoms, you come up negative, fine. If you're showing symptoms and you come up negative, assume it could potentially be a positive. Maybe not just for COVID, but any of the viruses. And if you're sick, just stay home. If you're sick, guess what? You have to miss out on the holiday cheer and the holiday gatherings this year because we can't afford to continuously just keep spreading this to different people. That is not working. I mean, deaths last week were just ridiculous. Deaths pretty soon are going to go over 2,000, maybe even 2,500. Who knows what the peak's going to be for deaths? Deaths are already rising as we are seeing COVID cases not hit their peak yet. And remember, deaths are the last lagging indicator. We're not going to see the highest reported death week probably until mid-January. Yeah, and here we are on December 13th. Yeah, that's not good. We'll be talking more about avoiding gatherings, being sick. I'm going to remind you of this many times as we get closer. Speaking of the holidays, Erie, Pennsylvania, school district to send students home with COVID tests for Christmas. Here's the idea. The government is sending testing out to schools, and the Erie School District, I believe, is getting, yes, they ordered 55,000 COVID tests. What they're trying to do is, should your child get sick over the holiday, before returning to school, take one of the tests that you are given. If you come up positive, you stay home from school. They're trying to avoid illness outbreaks, COVID outbreaks, because it's real. I tweeted a whole bunch last night, and there is one illness outbreak, non-COVID related, that we're going to talk about in just a moment. But first off, we have to get to this story from the television program, The View. Joy Behar. Now, I'm not a regular watcher of The View, but if you are, you know who this is. But you also know, even if you didn't watch The View, you also know Whoopi Goldberg has had COVID many of times. We've reported that on here. Well, the point here is Joy Behar has tested positive for COVID. She says the first time. Could that be true? Sure, it can be. But she's had exposure to other cases. We know Whoopi's had it many times. Has anyone else had it there? I don't know. But the point is, this is at least her first public case. She may have had an asymptomatic case in the past and just did not know it. You all know how that works. They don't always disclose everything. Or someone says, oh, just illness, brief illness, this or that. It's what happens, but hey, this is her first case, and she is off for the rest of the week. All right, now getting to that illness outbreak in California. Cafeteria deemed safe at Farmersville School after students fell ill, superintendent says. Let's read a little bit about this, because there's something I want you to see here. Classes resuming at an elementary school in Farmersville after nearly 4 dozen children fell ill on campus. The city fire department says 44 kids reported feeling sick Wednesday afternoon at Freedom Elementary. The children described feeling nauseous, dizzy, numb in their mouths and fingers. Here's where it gets interesting and very concerning. The department says 36 of them were taken by ambulance to the hospital. 36. Now, I don't know if they did more than one in an ambulance at a time, or did they do 36 separate ambulance trips? Don't know, but that's a lot of kids having to go to the hospital. And yes, the school went on lockdown as anxious parents were waiting outside for information. Yeah, this is concerning. What we do know is not just in kids and everyone. Anyone who's had COVID potentially has a weakened immune system, which allows these illnesses to spread more. Now, is this anything in relation to that? Don't know. But I did happen to watch the video, and they are going to investigate and try and figure out what is causing this. Now, speaking of COVID causing illnesses to spread more easily, look what's going on in New York City. RSV cases, this reddish-orange color, which is 2023 to 2024 season. Yep, just a rapid rise in RSV, and these are only the reported cases. We know a lot of people, if they're sick, oh, it's just a cold, this or that. They don't bother to see the doctor. They don't get tested. So how are they to know they have RSV? Yeah, pretty concerning when you already see the numbers quickly headed for 5,000. And I know someone's going to comment down below saying, oh, it's New York City. Millions of people live there. Again, most people don't even bother to get tested for this stuff. That's concerning. All right. Moving on to this now. This is not good news. And this is leading up to a two-part thing we're doing here. First off, let's start with Paxlovid. Paxlovid, the powerful COVID-19 drug, no longer free in 2024. That means the government's not going to pay for it. It's going to be passed on to your insurance. Maybe your insurance will cover it, maybe it won't. For those who don't have insurance, it's out of pocket. If your insurance doesn't cover it, it's out of pocket. And it's not going to be cheap. So again, they're trying to move things along as if we're done the pandemic. Here's another thing we're trying to move things along. This comes from Laura Meyer. She tweeted this. She did a whole thread. In fact, I will retweet this. Let's retweet it right now. And what we see here is this screenshot. That's what I want to show you. I mean, this is rather interesting. This comes from Today News. What is bed rotting, and is it good for you? What to know about the Gen Z trend. This is just like, really? They're talking, so what they're referring to is people, spending an entire day in bed, not getting out of bed, working from home. Hello, it's not a trend for Gen Z. This is something that has started occurring since COVID started. Hello Today Show, hello NBC. Did you forget about long COVID? People with long COVID, not everyone, but some people with long COVID become bedridden because they are so sick, they are so ill, they are so tired, they can't get out of bed. So this whole, we gotta rush you back to work, you gotta get back to work. Either you work in office or you can't work for us anymore. It's totally ridiculous. And another thing they're not realizing is the number of people that are starting to go on to disability are rising. Remember the other week, or I shouldn't say other week, it was this week. Remember the other day we talked about Oklahoma having a rise, one of the biggest rises in the country of long COVID. Oklahoma is going to be the state that we have to watch. That's going to really be the state, since they're having the highest cases of long COVID right now. We got to watch how the economy behaves there, what the work from home behavior is like, what the disability claim, everything. Oklahoma is the state to watch. And this whole idea of, come on, you got to rush back into the office, it's totally ridiculous. Corporate America needs to just stop with this nonsense that everyone is fine and it's just an excuse, you're just being lazy. No, it's not. People get infected, people get long COVID, people with long COVID are not fine, and they need to be treated for, and they need to be taken care of, and not tossed like a tin can and told, all right, you need to get back to the office or you're fired. It's totally ridiculous. All right, moving on. Let's take a look at today's air quality, and we see the air quality for today. Again, like always, it's mixed, but the central portions of the country are not doing terrible, but we do have this right here in Texas, and that's because there is a weather system there. It's providing some humid air mass, generally poor air quality. Not bad in the Great Lakes. The West Coast is what the West Coast will probably be through most of the winter. Same thing for the Mid-Atlantic. Nothing out of the ordinary today except for this continuation in the Gulf Coast, which now spreads up into the southern plains. All right, Walgreens this week. We do know the Walgreens positivity this week did go up. It is at 29.3%, and we expect that's probably going to continue for several weeks to come. Taking a look at some CDC data here. Let's take a look at the CDC variants. HV.1 leads the way at 29.6%. JN 0.1 is at 21.4%. We know this data is behind, so it's likely JN.1 is much higher than this number at this point. Taking a look here at COVID hospital admissions in the past week, 22,513. We're not looking at a peak until the beginning of January, so we expect this number to continue to rise. Taking a look at ambulance calls in Philadelphia County, Pennsylvania, city of Philadelphia, yesterday, 795. Let's do a live look in the Philadelphia suburbs. Not too bad right now for Montgomery County. Cheshire County, on the other hand, it was busy earlier, and right now it's not as busy, but sometimes it's just the types of calls, and we are seeing a few respiratory difficulties, sick person, heart problems, falls, EMS standby or special service. I think that's what that stands for. So not terrible. And actually, I do have a little bit of good news. I'm not always also negative. I can be good too. And New Jersey provides us a little bit of good news. Hospitalizations in New Jersey, 669. That's actually down from yesterday's number on a ventilator. 13 people on a ventilator, 78 people in the ICU. Discharge volume, 117. A little bit more good news. New York State did not see any big increase. Up slightly over the other day, but I mean, I expected it would have been higher by now. It's not. This is some good news. 2,245 cases. If things were continuing the way they were, and you can see that here in this chart a little bit, you would have thought today would be about 3,500. It's not. Now, also, another thing is, the PCR testing is very expensive if you have to pay for it out of pocket. A lot of people are doing those at-home tests. Most at-home tests are not reported. It should be a requirement in all states or required by the CDC. If you take an at-home test, you have to report it. It should be real easy to do. There should be a QR code. You should be able to snap a picture and it reports your result, but that's not the case. We would have a lot more reported cases. We would get a lot better picture of what's going on, but we don't. Moving on to this, and I have to refresh this, and you're going to be in for a little bit of a surprise here. New York State hospitalizations today did not rise. They actually dropped a little bit. So yesterday there were 1,791. Look at today, 1,779. That's right. They actually dropped a little bit. Like I said, take the good news when it comes. Will this last? I don't know, but it's a good thing. Now, we do note that there was a correction last week. Today being Wednesday, it's time for our weekly look at Texas. There was a correction. Remember, those cases were just really low. I wasn't understanding it, wasn't making sense. I was blaming it on testing. Well, Texas corrected. Previous week now says 11,572. This week is 12,702. That's up from last week, and there is a corrected number. It wasn't, what was it? I think it was saying 5,000. Yep, well, that number got corrected. So it's up by 1,130. But there is some good news. Deaths are actually down in Texas this week. 41 versus 52. That's down by 11. Hospitalized COVID-19 cases are up 60 by 68. It's 1,233. people in the hospital versus 1,165. Again, that is up by 68. And let's just take a look at Massachusetts. Some of these other states will not update until later in the week. I don't know about Colorado. We'll check that in a moment. 14.8% of all emergency department visits in Massachusetts are because of some sort of a respiratory virus, whether it be COVID, flu, RSV. Let's update and see if we got anything out of Colorado yet. Nope, not seeing anything out of Colorado yet. The most recent update was on 12-5 with 257 people in the hospital. Hopefully we will get more of these states to update again tomorrow, because Thursday is usually a day where we get a lot of states. Sometimes we get Ohio, sometimes we get some other states. And that's pretty much all we have for today. Hopefully tomorrow I will have some more international data for you. And I will see you again next time. If you learned anything or you like this video, give it a thumbs up. If you enjoy seeing these updates and you want to see them all the time, by all means, subscribe down below, hit the notification bell, which will notify you when I do a new video, which is just about every day, and share this with anyone who needs to see it. If you have a comment you want to add, by all means, leave a comment down below. I love reading your comments. I will see you guys all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday evening. Thanks for watching.